Hi guys, thank you for joining me today on this important topic, successful dental bleaching. My name is Dr. Shabir Hassam, and I'm going to be presenting to you today something about dental bleaching, and it's all about getting success in dental bleaching. So let's start. Who am I? I'm a dental dentist in private practice, member of the Swiss Laser Masters Academy. I can call myself a laser dental specialist with a master's in science and lasers in dentistry from Aachen in Germany. And more recently, I can call myself a researcher because I've been undertaking research work in bleaching as well as lasers. Lovely picture here of Uniclinic in Aachen, Germany. And let's get started with successful dental bleaching. So, uh, the overview of the topics today. What is the problem with dental bleaching? There is a problem in dental bleaching, and we are going to explore that. Where are we currently, most dental practitioners with dental bleaching? Where do we want to be? How do we get there? How do we understand the science behind dental bleaching? And what about treatment protocols based on science? So, what is the problem with dental bleaching? The main problem is it's a very poorly understood process. Most of us don't actually know how it happens. How does hydrogen peroxide cause a change in tooth color? We have some ideas. We know that there's a breakdown of the hydrogen peroxide. There's oxidation. There's reduction. But getting a little bit more deeper into it, we don't have a full understanding. And because we don't have a full understanding, we sometimes cannot work out how to treat, what's the best way to treat our patients. It is not well taught at undergraduate level. Maybe, there's not enough information, or the information has not been collated properly. And we left out we mainly left with a situation where products dictate protocols. So a dental product is they give us the how to apply the bleach, and how long to apply the bleach, type of trays, design of trays, etc. So we need to be a little bit more scientific and try and get a proper protocol. And what determines success in bleaching? Our determinant at the moment, our main determinant is patient satisfaction. But we need a better determinant of dental bleaching. So where are we at? Uh, a lot of us are doing providing home bleaching to our patients without a proper protocol. So what we do is we give them bleaching trays, we give them bleach, and we give them instructions. But where is the end? Where is it successful? Do we recall our patients? So there is no proper protocol that we are undertaking. A lot of us are undertaking in surgery bleaching. We're using branded products, and we're not knowing what to expect. How successful is this? What does the research say? We are not sure as yet. And it's a bit of a hit and miss. We sold poor products. Recently, there's been a product that's been heavily marketed, which is using a 6% hydrogen peroxide as a power bleach. Now, if we get into the science, we know that this is not a very successful concentration to power bleach with, but it is marketed. It was a product that was designed for the European market, where they are not allowed more than 6% hydrogen peroxide. But here in South Africa and many other countries, we are allowed quite high concentrations of peroxide, which do quite successful bleaching. So we need to know the products and not be investing in expensive equipment and pro products. But all this can come if we have an understanding of how and why bleaching works. Without this, we are just going on anecdotal evidence of people saying, "Oh, this has worked, and here's a picture of how well this product works," etc., or a demonstration. we get a demonstration, but a lot of times the teeth look slightly brighter, and it's not really a proper bleaching. Um, let's go on to where do we want to be. They always this we always want to be where the big boys are, and the big boys in cosmetic dentistry is the American Academy of Cosmetic Dentistry. And whilst I was reading up with my research, I came across this very interesting survey. In 2012, the survey of the American Academy of Cosmetic Dentists averaged 61 bleaching treatments for the year. Now, that's about a little more than one bleaching a week. And how many of us are actually doing one bleaching a week? If we are not at that level at the moment, then we need to get to that level, because it's something that is achievable. They were doing it in 2012. We almost 9, 10 years later now. And this second part was very interesting as well, because the in-office bleaching treatment was only 7%, and the combination of home and in-office treatment was 75%. And there's a particular reason for that, and we need to explore that reason. So, how do we get there? How do we get to 61 bleaching treatments per year, as that as a being our baseline? We need to begin doing more than that. So we're gonna dentists are scientists, and we need to use science to understand bleaching. And we need to separate what is between anecdote versus science, because anecdotal evidence, people say, oh, the teeth got whiter, but science will make a measurement of that, how much whiter the teeth got. So uh, i- for research purposes mainly, we measure the whiteness of teeth, and this is not, you don't need we measure the whiteness of teeth using a spectrophotometer. For general practice, you don't need a spectrophotometer, but the science, when using a spectrophotometer, can give us an accurate measurement of what is the shade change difference, and this reveals a lot of different facts to us. So we need to get into the research and start understanding the research, so that we understand how and why the bleaching works. So what does the research say about how bleaching works? There's loads of research out there, and we need to sift through this, and or we need somebody to sift through it, uh, and what and make sense of it. What does the research say about bleaching lights, lasers, etc.? How do these enhance the bleaching effect? What is These are some of there's many questions that need to be answered. These are some of the questions. How does the concentration affect the bleaching? Why does bleaching cause tooth sensitivity? Is it the same as cervical root sensitivity, or is it different? But we treat it a lot like cervical root sensitivity, but it's a totally different form of sensitivity. What reduces the sensitivity? How do we manage the sensitivity, etc.? And what are the factors that improve bleaching outcomes? So we need to look into the research and see what are the specific factors that improve bleaching outcomes. uh, and another factor is the microscopic and the macroscopic changes uh, in the tooth when subjected to hydrogen peroxide bleaching. So there's a lot of research work, and we need to gain a concise picture, a definitive understanding of what is going on. So quite commonly, we always thought of bleaching occurring because of this what they call the chromophore theory, that hydrogen peroxide, when applied to the tooth, there was a release of oxygen and hydroxyl ions which penetrated through the tooth and oxidize or reduce these chromophores within dentine and enamel. And that has been shown to be, not that model has been debunked quite a few times in a lot of research papers. So currently, the research is showing us, and with new types um, of tools to measure the concentration of peroxide within the tooth. And one of these tools is called Raman spectroscopy. And Raman spectroscopy, we can actually measure what is the concentration of the peroxide at different parts of the tooth. And the surprising thing that it showed us was that the peroxide penetrated, well, we would say absorbed or moved through the enamel into the dentine, and it actually concentrated itself at the dentino enamel junction. Now, uh, so this then gave us a new idea of how this bleaching is actually working, that instead of using lights and accelerants on the surface to accelerate the hydrogen peroxide, we should now be looking at ways in which improves the absorption of the hydrogen peroxide through the enamel and into the underlying dentine. And then we look further at at the factors. Is concentration a factor, or is lights a factor, etc. So there's a lot of research out there saying different things, uh, but there is a large body of research giving us more specific ideas on how this bleaching is actually working. So evidence-based successful bleaching, and I've stolen these slides from one of my other lectures, as you can see. um, and it was more, this lecture was more about power bleaching. So the questions that, why does my power bleaching not work all the time? I want to get the same results that my friends do with their patients on Instagram. So I always see my friend from Cape Town. He's posting these beautiful pictures of amazing results he's getting with his bleaching, and I want to be happy, and I want my patients to be happy with the results. So let's answer some of these questions, and we can answer these questions with by looking at the research, at some research. And a few years ago, I can't remember the exact year, but there was a study done by Lee et al. At Loma Linda University, and a large study. I think it was over 160 participants. It's this huge bleaching study, and they were looking at power bleaching, and they were looking at two specific power bleaching methods. One was a zoom, and one was the opalescence boost. And these products are quite popular worldwide and even in South Africa as well. And let's have a look at some of the results of this study. So now, when this is the table, and they're talking about something called delta E. Now, when we measure with the spectrophotometer what is the color change in bleaching, then there's a calculation, and we start to get a measurement. And as we get the measurement, there's delta E can be 2, 4, 6, 8. Now at around 8 is where if it's 2, 4, you don't really see it. Between 6 to 8, you start to see that color change. And patients getting 10, 12 are a little more happier. 14, 16, 18 is the ones above the ones we see our friends posting on Instagram. So post bleaching, now the blue ones are the zoom, right? And the zoom was using a 25% hydrogen peroxide, and the opalescence boost, I think it's about 35% or something. It was a much higher percentage, the thing. And the study, the results of the study, even though the authors never directly said it, but it could be shown that, well, or you would think, well, the zoom is performing better than the opalescence boost, and it must be that beautiful zoom light. But when you get deeper into it, you'll see that the application times were different, uh, according to the manufacturer's instructions, etc. But the interesting thing was not that. The interesting thing was at this level of 8, which I would say above. If I get something above 8, I'm happy with that, with that power bleaching. Between 6 and 8, well, that's, we normally get that. Um, but above 8 would be the thing. But if we draw a line here, and we look at the number of participants all below this 8 level is a huge number. Let's look mainly at this post bleaching. It's a huge number. So very few patients are actually successful with get successful power bleaching. Yes, we are looking at that and we're thinking why all our patients are not on top there, but there's a variety of factors uh, that allow some patients to go to get such a large change, because there's something simple like bleaching. The understanding that bleaching doesn't add whiteness to your teeth. You remove yellowness. It bleaches out yellowness. So if somebody is at a shade A1, their color change is not going to be a lot. But if you get participants with the A3.5, etc., they're going to have a large age of the patient. There's so many variety of factors that would cause that. But the main thing is, and the point to take from this is that, and you'll find this in a lot of studies, not only this study, a lot of studies, that the majority of patients having power bleaching will not have a successful result. And that is why there was only 7% of the dentists in the American Academy of Cosmetic Dentistry doing power bleaching on its own. So the combination of home and power bleaching needs to be pushed, or it needs to be combined in order to get a successful bleaching result. And we'll talk more a little, just a little down the line, on what I mean by a successful bleaching result. But the one more point I want to make here is that when we looked at day 7 and day 30, there was an improvement on the immediate post bleaching result, and this once again points to the bleaching being an absorption process, because uh, once as the peroxide is absorbed, the bleaching continues until the peroxide dissipates from the tooth. So that's a closer view, and we can see uh, the box plot. So let's talk about what is an outcome-based bleaching, because we are doing bleaching, and we don't even know what we're basing our success on patient happiness, or the teeth look a little bit whiter, and this is success. But let's look at an outcome which we can, a tangible outcome in which we can say, okay, we've reached this tangent point, we've reached this point, and at this point we could say that it is successful. Second. Okay, good. So can we predict a fixed outcome? And what is, and what is the benefits of a fixed outcome? And, obviously successful bleaching is, is when fixed outcome is reached. Now, at this point, the outcome-based bleaching, unfortunately, the research hasn't reached this point. And, I would love to do a research project on this outcome-based bleaching, because now it moves on to the point where it's my own anecdotal kind of evidence. And I've been doing it for a long time. And the anecdotal evidence has shown me that we can predict a maximum bleaching result as 1M1 on the Vita Shade Guide. Uh, Even though we have no studies to prove this, I've been doing this for the past 10 years with a majority of success. That means that my bleaching is ends or is successful. I deem it as being successful when the patient has reached a 1M1 shade. So what is the advantage of having this, and is how do I know the patient's going to reach that? Well, I know because I've done it so many times, and as I said, it's anecdotal. I can't put a research behind it to say that this is the research that shows that this outcome we achieve it in 80%. This outcome we would achieve in 10%, or etc. etc. So at the moment, I use the 1M1 as my outcome and as my target shade. And it's your best elevator pitch. When the patient is sitting in your chair, the patient is seeing the hygienist, your hygienist, the patient is seeing your therapist, etc. They can be shown what can be achieved with dental bleaching. If a patient's teeth look a little bit yellow, I don't say, well, I can give you a dental bleaching and it'll make it white. I show them what can be achieved, and we achieve it uh, most of the time. And if you're going to be doing a case of veneers, or you're going to be doing a case of crowns, full mouth rehab, etc., any aesthetic work, then how much more improved can your aesthetic work be if you combine bleaching with all this type of treatment? I'm just going to skip through the next slide. It further elucidates this 1M1, but on your 3D shade guide, there's your 1M1, and you'd be using that shade tab to the thing. Uh, and let's move on now to the home tray system, and you know. I wonder if there's still I know there's still people who use reservoir in the bleach trays, because I still see the labs doing reservoirs for dentists in their bleach trays, and it's such an outdated concept. And when we look at the research and why we shouldn't be using reservoirs, and actually how what would be a new modern design for the bleach tray, we know that we can get bleach trays which are much more effective. In this picture over here, you can see the grooves here. These bleach trays are made from 3D printed models, and we're constantly thinking of ways of improving our bleach trays. They look like retainers, and we can. But why a certain design of bleach trays can give us much better results and be more effective in our bleaching? And finally, well, I hope it's finally. The other thing that we need to consider that hydrogen peroxide is a cheap product, and bleaching syringes are expensive. And what are we paying for? Are we paying for a brand? Are we paying for production? And is the cost limiting our bleaching? Because the thing is that if I'm saying that I want to do an outcome-based bleaching to reach a certain shade, that it's going to eat into my costs if I'm continually giving this patient syringes to bleach to reach that outcome that I promised them. Well, I don't normally have to give patients that much syringes, because I have good tray design. I've explained my patients how the bleaching is done, and everybody understands the process, and we get excellent results with just a few syringes of bleach. But there are some, I have to accept that there are some patients who are difficult bleachers, uh, and we need to have a variety of different concentrations of bleach available. We need to have different ways and techniques. And if I'm counting my cost of my bleaching on a set of 4 syringes of 10% carbamide peroxide, then it's not really going to work out for me to be doing this outcome based bleaching Dr. Hassan is talking about. But over the past few years, uh, I've, fu- uh, I've started to make my own bleach syringes, and the thing is that I've started to get much better results than using the carbamide peroxide, and the cost is much less. And it is possible to make your own syringes of hydrogen peroxide. It's a simple, easy process. We all have done chemistry at university level. And that's why they were teaching us chemistry at the time. We didn't understand what was this chemistry for, but here's another application for the chemistry, and it's basic chemistry, and we can provide concentrations of bleach more suited for our patients. We can provide hydrogen peroxide which will be absorbed much better than a carbamide peroxide. We can adapt our concentrations for what our patients require. So it's not about the cost of something mainly. It's about being having the ability to do outcome based bleaching, because we have the flexibility of having different variety of concentration of peroxides at our disposal. So it's something to think about, and move forward. Um, you know the marketing of dental bleaching is so key in us attaining that 50 plus, that 60 cases a year, or more than one a week. And once uh, your staff or your are trained, your hygienist is trained, then you're overseeing the process. It's a very you start to gain this passive income, and it just takes off from there in your practice. So it's a huge source of income, for a potential source of income for your practices, and a little bit of marketing. And the best form of marketing, you don't have to spend a lot on the marketing, is your in-house marketing. It's your patients that are there, showing them what you can achieve one-on-one. It's your adjunctive treatment, that means adding bleaching to your veneers, your cosmetic treatment, adding bleach, so patients having implant work, and once it's offered, and if you can offer them an outcome, and that's why I'm pushing the story about the outcome-based bleaching. Once you can offer them an outcome, it makes the whole process, it makes the whole selling so much more easier. So uh, let's go over the key takeaways. What do we For successful dental bleaching is, you need to become a believer. You need to believe in the science. You're a dentist, and I get so many times at bleaching lectures, people come up with dentists uh, talk about anecdote, and and I say, it's the science. You need to believe in the science. When you believe in the science, you will understand how bleaching works. You will be able to do successful bleaching, and you'll be able to deal with any kind of issues that come up, sensitivity, not bleaching, because you have a full understanding. So the understanding of the models, of how the bleaching works, communication with your patient, because you can explain to them that, if you this is what you're going to feel. If you're going to feel a bit of sensitivity, this is what it means. This is how you cope with it. So the patient management is also much easier. um, and also, not only you are a believer, your staff, everybody understands the process. So when you walk out of the room and they ask about the bleaching, or at reception they ask about bleaching, the staff can talk about it, they can sell it for you. And this outcome based treatment is so important, that we are able to give patients a fixed outcome. We can say that this is successful bleaching, and we're not just flapping about in the wind like we are at the moment. And once we understand it, and once we have the ability to apply it, we can now start adapting and improving the way we bleach. So I would be able to give you a certain amount of information, but you would then start thinking in ways of improving the bleaching and improving how you apply the the, the bleaching products, and avoiding the dental tax associated with dental bleach is going to be a big block that is stopping us from doing excellent bleaching. So how do we get this right? And here's my punt, the reason why I did this lecture. And you see that, even though there's a lot of information, we just skim through a lot of on the top of it, and and rightfully so, because these things need in-depth discussion, on the research, and a little bit more deeper understanding that can than what I can afford in a half an hour or 45-minute webinar. So this is my course that's coming up on the 4th of April, and it's a masterclass in dental bleaching. It's a single day. Uh, the venue is in Durban. If there's interest in other areas, then hopefully later on in the year we can have different areas. But the first one is in Durban, and obviously, with COVID, we've got limited. We've cut the class size down to half, so it's a very small class that we're going to be accepting. But we will get into the literature review, get into all the science behind dental bleaching, and show you how exactly the bleaching is working. We would look at the management of problems like tooth sensitivity. How do we get the shade? How do we take the shade? The full protocol, power bleaching, and then we get into the interesting bits of optimal dental tray, bleaching tray manufacture, how you can manufacture it on your own, or if you're sending it out to the lab, instructions to the lab, etc. And then the great bit about how do we the bleaching gels, what is the constitution of the bleaching gels, and how to able to reconstitute our own bleaching gels specific to our needs and to our patients. And so all those important areas will be covered. And at the end of it, I want participants who partake in this be able to have a good grasp on dental bleaching and be able to provide successful dental bleaching, and eventually, the initial target of reaching those one case a week, and going on further from there. So the course, we don't have much time for the course. It's going to be in a few weeks' time, and then a second course will be done later in the year. And I said also it's a very limited number. Course coordinator is Kyle, and his number is on this leaflet if you want to take it down. So thank you very much for listening to me today. I hope it was entertaining, interesting, and hopefully we'll see you soon at the course. Thank you very much. You can have a look at my website, my tooth whitening website. It's part of the marketing. It's called wowtoothwhitening, wowtw.co.za, and that's my contact number. You can WhatsApp me, and please don't send me a WhatsApp. How do I mix bleaching gels? Uh, you know, let it be a bit intelligent. But thank you very much, and bye bye.